Thanks to President Obama, who cares deeply about the poor, 30 million more Americans will soon receive health insurance. But will they be able to schedule a doctor's appointment? And when? And what about those of us who already pay for health insurance? I'm PJTV's Scott Ott, joined now by Bill Whittle and Stephen Green. Well, men, the New York Times says the doctor shortage will get worse under Obamacare. A depressed region of California, for example, will need 5,000 more doctors within 10 years, and it won't get them. Things aren't much different in Detroit, suburban Phoenix, the Mississippi Delta, and elsewhere across the country will be 100,000 doctors short by the year 2025. Relatively low pay for family doctors moves more med students to become specialists. Low Medicaid reimbursement rates chase more family doctors out of the government's program for the poor. And with Obamacare's focus on wellness and free testing, waiting rooms will fill up with folks who feel just fine at the moment. Now, Bill Whittle, let's be honest. Aren't longer waiting periods simply the morally necessary price that a just society must pay to make sure everyone gets covered?
I don't know how you do it, man. I just don't know how you do it. Every week you come in here with the perfectly phrased devil's advocate question. I just don't know how you do it. Wrong, no. The entire theory of civilization and progress, capitalism and individual freedom is simply the ability that if you work hard, you should get to live a life of relative comfort and luxury. And if somebody won't provide it to you in a free society, you can go to other people who will. This is the entire purpose of Obamacare, is to eliminate choice from health care. Because once you do that, then the government really controls your vote because they control your absolute life. Now, one of the problems with this doctor shortage is there's a long lead time. You can't just make these people tomorrow. You can't just crank them out every year. You've got to train a doctor, believe it or not. And I think we're going to start to see, well, look, everything obviously is going to hinge on what happens in November and immediately following November. If we can repeal this Obamacare, which will require the House, the Senate, and the presidency. But if we can do it, we can start looking at some free market alternatives to Obamacare to plug the holes and the weaknesses that do exist in the American health care system. Relatively small numbers of people have some real problems compared to the general population's health care. But we can solve those problems very easily using free market methods that cover everybody better. But the first thing is a political solution. And this is the entire purpose of why Obamacare gets conservatives so crazy, because it is no longer going to be the DMV now. You're not going to have to wait 5 hours to get your driver's license. You're going to have to wait 5 hours to get your sore throat looked at or your daughter's runny or bloody nose looked at or whatever. We all know what's coming, Scotty. We all know it's coming.
Well, Stephen Green, Medicaid reimbursement rates have been so stingy, doctors say they can't afford to do the work, and so some are bailing out of the system. Can't we solve this by simply increasing reimbursement rates to match market rates, or perhaps even requiring doctors to accept Medicaid?
Require them. I love that. Make it a mandate that they do it. Yeah. A mandate. No. It's not. It's a tax. If you don't see Medicare patients, you'll pay a tax, not a penalty, not a mandate. Tax, or make it a condition of their medical license. If you want to get the government piece of paper that says you're a real doctor, you have to take the government patients for free. Look, I'm not sure how that's any different from Rahm Emanuel telling Chick-fil-A they can't do business in Chicago unless they support gay marriage. Look, we know Medicaid has got to be reformed because as it is, the only possible way to contain costs, the way it's set up, is you either screw doctors by hardly paying them anything, or you screw seniors by making it impossible for them to find a doctor who will treat them. That's the system we have. Obamacare took $500 billion out of that mess up. So first we've got to repeal Obamacare, as Bill said. Then we've got to fix Medicare because it is very deeply broken.
Well, Bill, there is some good news in California's so-called inland empire. They have no shortage in two categories of doctors, dermatologists and plastic surgeons. Now, why can't we just copy those examples to boost the doctor supply in other fields?
You know what other medical procedure is doing super well, Scotty, is LASIK. LASIK eye surgery. LASIK eye surgery, plastic surgery here in California. Those guys are making a fortune. Would you like to know why those two single aspects of the entire healthcare spectrum are doing well? It's because those are the only two, I guess dermatology is included, that are based on free market principles. People want this. It's not covered by insurance, so people will pay for this, and they'll pay market rates, which means there's competition. Which means there's competition not only for low prices, but also for quality of service. Doctors have reputations, imagine that. And the people who have the best reputations can charge more money. People who only have a limited amount of money, who are still willing to get a procedure done by a guy with a lower reputation, will pay a lower price, they'll get a lower quality of result. It is exactly what's working, and people who are in dermatology or plastic surgery are making a fortune because they are not tied to this government wagon that is dragging all the rest of us off the cliff. So it still makes sense for a person to study. Can we just say this again for the sake of those potential doctors and med students out there? People who are ready to give up 12 years of, not of their life, of their youth in study in order to become the most skilled people in society deserve to be rewarded commensurate with their sacrifice in order to attain that level of skill. That reward is still possible in plastic surgery, but it won't be soon. And all of this excellence and all of this reward is determined to be stamped out by an administration that is utterly opposed to individual achievement, individual excellence, and wants nothing but the lowest common denominator for the largest number of people.
Well, Steve, because the government is deeply enmeshed in the healthcare market already, through Medicare, Medicaid, the FDA, the Department of Education's regulating med schools, a legal system that permits a huge malpractice judgments, state insurance departments, I could go on. Isn't the government obligated to do something to address the shortage of doctors? I mean, if government caused the problem, shouldn't government fix it?
Yeah, have more of that hemlock. You'll feel much better in the morning, Mr. Socrates. Look, Bill was really onto something when he talks about the kind of people today who become doctors. They are our best, they are our brightest, they are some of our hardest working, and certainly some of our most compassionate. They literally do get to play God, and for the most part, they're good at it, and it doesn't go to their heads. Now I want you to think about the system that ObamaCare has imposed on this country, where doctors are going to be paid poorly. They are not going to be able to make decisions about the care of their own patients. That's going to be a bureaucrat's decision. You're going to lose these people. Instead, you're going to get a new kind of person who goes into medicine. The kind of person who is willing to work for low pay and long hours. The kind of person who is willing and happy to take orders from a government bureaucrat. Now, I want you to think about what kind of care you're going to get from that kind of person.
Well, the United States can do it, we're told. After all, England covers everybody. What they don't say is that 2/3 of upper-middle-income Brits also buy private health insurance to cover hard-to-get specialist care, to avoid months of waiting and crowded government facilities where septic conditions abound in 6-bed wards. But statistics only say so much. For most folks, it all comes down to one patient. Kane Gorney survived a malignant brain tumor in 2008, but the drugs weakened his bones, and he went for a hip replacement in May 2009 at age 22. But busy hospital staff failed to read his medical history and refused to give him a glass of water, though he cried out for it more than once. He even called an emergency operator, and the police came to the hospital, but went away when nurses told them Mr. Gorney was simply confused. Kane Gorney died there of dehydration. It can't happen here, you say, but somewhere near London, a mother stands by a grave, staring at a stone. England covers everybody. For Bill Whittle, Stephen Green, and the entire Trifecta crew at pjtv.com, I'm Scott Ott.